So, Dr. Wen, I want to start by talking about the alarmingly high number of cases the country is experiencing right now. Dr. Fauci has said we have a surge superimposed upon a surge. A lot of this is being driven by Thanksgiving travel and people getting together. Are you concerned that with Christmas coming up and the holidays, that the healthcare system could soon exceed what it's capable of treating? And how do you convince people to stay home and take those public health measures during the holidays?
Yeah, so I'm extremely concerned about where we are as a country right now because we are seeing some devastating numbers. Really, these numbers are the worst case scenario of what we could have possibly imagined several months ago. If you had told us several months ago that we would at a point where we could soon exceed 3,000 deaths a day, that we're consistently seeing more than 200,000 new infections. And by the way, we have not even seen the impact of Thanksgiving yet because we know that the incubation period is up to 14 days. And so it's actually just this week that we are going to begin to see the impacts of Thanksgiving travel when 50 million people or so traveled and gathered. And by the time that we get to see those numbers reflected in hospitalizations, and by the way, these are already hospitals that are so overwhelmed already, that takes us into Christmas and into New Year's, where we may have yet another surge upon this unsustainable surge. And so I am deeply concerned because our hospitals are already at the brink. And I know this is hard to say, but we are already rationing care. Because when you have an ICU nurse who, let's say, normally takes care of 5 patients, who's now taking care of 10, when you have people working in ICUs who are not normally trained to do so, patients are getting less than ideal care. That doesn't just affect patients with coronavirus, but also other ailments as well. And so to your point about how to convince people, frankly, I'm not sure, because people are not acting like we have this dire situation. And now is really the time for us to hunker down because we have to get through this winter. As great news as these vaccines that you and Dr. Besser have just been talking about, the vaccines are not going to save us this winter. The only things we have this winter to save us are those same public health measures we've been talking about all along. Wearing a mask, physical distancing, not having indoor gatherings.
Another worrying trend is we're seeing nurses and doctors quit because of exhaustion, feelings of isolation. A lot of them are working in unsafe conditions without adequate personal protective equipment. So you see hospitals and healthcare facilities having personnel shortages. What does that mean as we're fighting this next phase of the pandemic? And how concerning is that as we get further and further into the winter?
We as a country are not prepared for something of this scale that we are currently facing. And what I mean is when you look at how we normally do preparedness, we are ready for, let's say, a hurricane that strikes one area, a region for a specific period of time, because then supplies and staff critically can be flown in from other places to help that one place that's inundated. Well, that's what happened back in March and April when it was New York City, the Northeast, parts of Seattle, Washington that were hard hit. That's also what happened in June and July when it was the Sun Belt, California, Florida, that were hard hit, Arizona, Texas. Then you could get supplies and staff come from other places to relieve those healthcare workers. But now, when it's all 50 states, when the entire country is a hotbed of infection, you just don't have relief. And I think the other issue is people are burned out because there is no end in sight. We don't even know when this current peak is going to hit. Maybe it'll be in January, but maybe it'll be after that. And I think it's an extremely difficult time. And I think what people need to realize too is that hospitals are the last line of defense. Individuals in the community are the first line of defense. And so what we do in our daily lives, that's what's going to be so critical for saving our healthcare system, and in addition, protecting one another too.